Let's talk about UTIs in seniors. And yes, it's a thing that we just brush off, but we really shouldn't. So, this is a real conversation about something that doesn't get talked about enough. But before we jump in, I want to tell you I'm Dr. Joy, and this is Conversations in Coffee with Dr. Joy. I am a content creator and educator who loves to educate whoever is eavesdropping on this channel about the latest trending topics. So today, this conversation is about UTIs in older adults.
Do you know that the symptoms of urinary tract infection can be different in elderly people than they are in the younger people? Do you know what symptoms should send up a red flag so that you get your mother to the doctor as soon as possible?
Sure, it's not exactly a dinner table topic, but if you or someone you love or someone you're taking care of has dealt with a UTI, you know how frustrating and sometimes downright scary it can be. We tend to think of urinary tract infections as something, younger people get. Maybe after not drinking enough water or wearing tight gym clothes too long. But let me tell you, for seniors, UTIs can be a whole different ball game. They show up differently because they can cause unexpected issues and they often get misdiagnosed. So let me break it down to you. What is a UTI? I'm not going to tell you. Let's hear from the experts.
What does it mean to have a urinary tract infection? What are common symptoms? How bad can they get?
Yeah, so it is an infection of bacteria in the urinary tract. And I think the important thing to think about there is that is sort of comes from the urethra, where the urine comes out of the body, and then up in a man through the penis, or inside the woman's body into the bladder. And then that can go up through the ureters into the kidneys, which sort of sit in your back. If it is in the bladder, we call that a cystitis or a bladder infection. Any infection that is able to spread above the level of the bladder is a more involved infection, an infection in the kidneys, and can actually lead to sepsis, which is a whole body infection where the bacteria can get sort of loose and out of where it's supposed to be. And that can lead to hospitalizations, intensive care unit, and even death. So you can die from a urinary tract infection. That is absolutely true, though it is very uncommon to die from a urinary tract infection.
Now that you have heard the doctor's definition of what an UTI is, think about this question. Why do older adults seem to get UTIs more often? Think about it. Well, from our research, I can tell you that aging brings a whole set of changes to the body. And unfortunately, some of them make infections more likely. Example, your bladder muscles weaken. And what this means is that the bladder doesn't always empty completely, leaving behind a little bacteria pool of urine. Your immune systems slow down. The body just isn't as quick to fight off infections anymore the older you get. Hormonal shifts happen, especially for post-menopausal women. Changes in estrogen levels can make the urinary tract more vulnerable to bacteria.
But UTIs in a woman's lifetime, probably 40 to 50% of women will have a UTI. And in any given year among older women, 1 out of 10 may have a UTI, if not higher.
So chronic conditions complicate things like diabetes, dementia, and other health conditions can make UTIs more frequent and harder to catch early. And if you have a catheter, the risk increases even more. So with that being said, here's where things can get a little tricky. Here are some sneaky symptoms no one talks about. And the reason no one talks about it is because seniors don't always show the classic UTI symptoms, like burning during urination or the constant trips to the bathroom. Instead, they might experience things like confusion or brain fog. That's a big red flag. Dizziness or falls, fatigue and sudden lack of energy, the loss of an appetite. And the one that we really see in healthcare, or if you are a caregiver, we see agitation and mood swings. Yeah, a UTI, they can make an older adult seem like they suddenly have dementia or depression. This is why so many UTIs in seniors go unnoticed and get misdiagnosed. Now, if you see an elderly loved one acting strange out of nowhere, it is sometimes worth asking the doctor to check for a UTI instead of just saying, oh, they have dementia, oh, they're older and they are experiencing memory loss. Sometimes it's not that. It can be easily a UTI. And remember what I said earlier, UTIs affect older adults differently. So these are the sneaky types of symptoms. And I know you probably know the most common symptoms, but let's hear about these types of symptoms, the more common types of symptoms from the doctor.
What are common symptoms? What are the sort of symptoms that might lead a person or a family caregiver to think, oh, this could be a UTI? What is it like to have a clinical UTI?
Right. So you do need symptoms. So let's just say that. So you need the presence of bacteria. If there's no bacteria and you're still having pain when you pee, it's due to something that isn't a bacteria. So you do have to have the presence of bacteria and then signs and symptoms in the urinary tract. Those include pain when you pee, having to pee more often than normal. Like, I feel like I have to go every 15 minutes. Like I have to go, but when I pee, there's nothing there. Incontinence, like I can't hold my urine. I just like wet myself, that's not my normal. Normally
and usually I do hold it. And usually you're having more trouble than usual.
we all might have issues because if we've had babies, you sneeze, you cough, you leak a little. This is not that. This is like, yes, normally I can hold it. And then suddenly I wet myself and I never do that. So we talked about frequency, urgency, like I have to go. Like it's that, normally you can ignore your bladder a little bit, right? You could say like, oh yeah, I'm going to have to pee in the next 30 minutes. Well, there's also when you have a urinary tract, the bladder just gets really irritable. And so it's really like, I don't have to pee. And then suddenly it's like, oh my golly gosh, I have to pee right now. I have to get right there. And if I don't, I am going to wet myself. Signs of an upper infection in your kidneys, that pyelonephritis, can be that pain in your back.
Or kind of like the middle low back, right under the ribs, lower ribs, right?
Yeah. Just so people can know that's sort of where the kidneys live in your body. And then obviously, if you're having fevers or chills, that's again a sign of a whole body infection, which can be more serious. Blood in the urine, if it's frank blood, it is actually probably more likely something else. Do you have a kidney stone? God forbid, do you have a bladder cancer? So frank blood is probably not. A little bit of blood might well be, but not usually frank blood. And then there are other things where people are like, gosh, the urine smells funny, or the urine doesn't look normal. And it's like, well, you eat asparagus and your urine smells funny. There are lots of, you become dehydrated, right? Maybe you're feeling crummy, and then suddenly your urine smells really concentrated, and it might even burn a little because uric acid is burning. And if you can't wipe well and a little urine stays down there, you can get some, irritation. And I've seen some incredibly distressing, like contact dermatitis from urine, where people maybe have some incontinence at baseline, and that can really irritate things. But that, if it's just my urine is a little stinkier than normal, or it's, the color's a little not right, that it's cloudy, that's dark. Right. Those might be signs of something. That is, you're dehydrated, but less just, they're not considered to be a sign of a urinary tract infection.
Yeah. And I think it was even actually like studied at some point that these visual signs that people were often using, especially nursing homes, to sort of presume there's a UTI, actually did not correspond to the presence of them. So
now that you know the symptoms, what are prevention methods to use, or what are small steps that would make a big impact when you have a UTI? Preventing a UTI doesn't have to be complicated, but we can say this, that UTIs aren't inevitable. A few simple habits can make a huge difference, like something that a lot of people don't like doing is drinking water. Seriously, if you drink water constantly, it can help with prevention. Dehydration is a huge factor in UTIs. So what I want you to do is, for yourself or anybody you're with that may be experiencing a UTI, encourage drinking water throughout the day. Another prevention measure would be, don't hold it. Go to the bathroom when you need to go, because holding your urine too long lets bacteria multiply inside. And then, especially, for anyone that's going to the bathroom, wipe from front to back. Now, I know you're like, oh my gosh, she's talking about this. Yes, this is going to help you prevent a UTI. So when you sit and you go, wipe from front to back. Basic hygiene can help keep bacteria out of places it shouldn't be. And another prevention measure, some doctors even say cranberry juice. That's maybe. Some studies say yes, some say no, but many people, including some of the clients that we have in healthcare, many people swear by cranberry supplements for UTI prevention. Consider also probiotics. They can help balance good bacteria, which may reduce the chance of infections. And remember to manage chronic conditions. Keeping your diabetes or kidney issues in check can lower your risk of a UTI. Now, I listened to another doctor as I was doing my research on preventive measures, and this is what he said.
Now, when people think UTI, they automatically go to cranberry juice and cranberry supplements. That's been somewhat effective, but not very effective because the cranberry tends to make the bacteria slide off and not stick to the inside of the bladder wall. So cranberry in general, I think, is good for a preventative thing. And I'm talking about maybe cranberry pills, not the juice, because there is some sugar in there. But typically, once you have a UTI, cranberry juice doesn't really work that well. Okay, so what I'm going to recommend is something that does work a lot better. It's a combination of oregano oil capsules as well as thyme capsules, okay? Now, both of these are pretty potent herbal, natural antibiotics, specifically with this natural chemical in both of these plants called carvacrol. Now, when you get the oregano, make sure it's at least 60% carvacrol. And I would recommend taking at least 200 milligrams, at least, it could be more, 4 times per day of oregano oil. And as far as time, try to find something that's 500 milligrams, and you can take that once a day. Because this chemical in both of these plants inhibits biofilms. It also kills E. coli, the major microbe that's involved in this infection. I'm also going to recommend taking apple cider vinegar, 2 tablespoons in 16 ounces of water, to drop your pH, to make your pH more acidic. If you're more acidic, there'll be less pathogenic microbes. The acid tends to inhibit the formation of these microbes. The other thing I'm going to recommend is to drink at least 2.5 liters of fluid a day. And of course, you can add that apple cider vinegar to this liquid, because the more fluid you have, you can actually assist in help flushing out these microbes as you're killing them with these 2 things right here. There's also an optional step I would recommend, okay? Taking some natural diuretic. That way you can help to increase the flow of urine through these channels through here. Asparagus is a really good natural diuretic. Dandelion greens is another good natural diuretic, or potassium citrate, as in a lot of electrolytes. Okay, so that will help flush things out very nicely. Now,
you've heard the preventive measures of a UTI. You know how to recognize symptoms of a UTI. So when is the time to see the doctor if you suspect that you or someone you love or someone that you're taking care of have a UTI? If a UTI is suspected, don't wait it out. Get it checked. Remember the symptoms that we talked about earlier. Get it checked. Just because you have memory loss does not mean you just automatically have dementia. Okay, so get it checked out. Seniors can go from being a little off to seriously ill in no time if an infection like a UTI spreads to their kidneys or bloodstream. That's why it's so important for when you're recognizing symptoms, when you're seeing these things happen, you need to get it checked. Doctors will usually prescribe antibiotics and symptoms should start to improve in a few days. Just make sure to finish the whole prescription and not stop early. You know how we tell our children when we're giving them antibiotics, oh, I know you feel better, honey, but we need to keep taking it. And they're like, no, mom, I don't really want to take it. No, because what happens if you stop early, it can make things worse. So make sure that you take the whole prescription. For those dealing with recurrent UTIs, doctors sometimes may look at other solutions. I have dealt with that with clients. Our caregivers have dealt with that on many occasions with clients who constantly have UTI after UTI after UTI. And the doctor is prescribing antibiotic after antibiotic after antibiotic. Okay, so really talk to your doctor. And maybe if you're continuing, or someone that you love or someone that you're taking care of, when they go to the doctor, say, hey, you keep prescribing these antibiotics. Can we look at other solutions? Maybe like medication changes, maybe from one antibiotic to another antibiotic, because your body can kind of get immune to those things. Possibly estrogen therapy for women, or even you yourself having some lifestyle tweaks. UTIs in older adults are more than just a nuisance. They can impact memory, mobility, and just, the overall health of an older person. I know, I see it happen. I work in healthcare and we work with seniors. Our care staff, we work with seniors. Those conversations that I hear from my care staff, that I see on documentation when they write notes to us, we see it all the time. So when we see these things, We talk to family members. We tell them that if they don't get this taken care of, it can impact their memory, the mobility, and their overall health of the person that they love. So what I would suggest is educate yourself through this YouTube episode that I'm giving today. Educate yourself through the research that you're going to do yourself. Educate yourself by providing you or your loved one with preventive measures before it gets bad. That is why I felt it was necessary for me to have a conversation today with you about UTIs. Knowledge is power. But anyway, with awareness and being in a proactive care, UTIs don't have to be a constant battle. You've eavesdropped today on this conversation. Now share this information and keep the conversation going with other eavesdroppers in the comments. Pay attention to the signs, and most importantly, stay educated and informed through conversations like this and chatting in the comments. Have a great day, everyone, and I hope that this have brought you some education and something to think about moving forward.